Hello, everyone. Welcome to Innovation Dialogue. I'm Diana Dean. And today we're going to talk about empowering and strengthening AAPI youth facing mental health challenges in fulfilling their collective American dream. And we know that our youth and students are feeling anxiety and depressed, and they spend a lot of time on their phone, especially during the pandemic. They struggled with the mental health issue for years, even before the pandemic. Today, we have all the great speakers here talking about how can we help and what the whole society can work together to support them. But before that, I would like to thank to May, SK, Jack, Masha, Sandy, Angela, and AAUC to make this possible. And this program is brought to you by AAUC and Dinding TV. Today we have four wonderful speakers. Dr. Maya Uchida, the professor of psychiatry at Harvard Medical School, and Chris Norwood, Milpitas School Board Trustee President, Elaine Liu, President and CEO of Mental Health Association for Chinese Community, and Sue Chow, the co-founder of True Youth. Before we start, I would like to invite each one of you to give a short introduction about yourself. Dr. Maya, please.
Absolutely. Thank you so much for having me here among the wonderful panelists. My name is Maya Uchida. I am a child psychiatrist and assistant professor of psychiatry at Harvard Medical School. I also work as a clinician and researcher at Massachusetts General Hospital, which is a Harvard affiliated hospital. And I am the director of the child depression program at Massachusetts General Hospital. I see kids every day, and this year has been an extremely difficult year for everyone, for the kids and their families. And among the Asian population within America, there's been an even further burden upon our population and community. So this is such an important conversation that I am so happy to take part of. So thank you again.
Thank you, Dr. Maya Uchida. So honored to have you. So Chris, it's your turn.
Thank you, Diana. Good evening, everyone, and thank you, distinguished panelists, for taking the time to be here as well. I am truly honored. As Diana has stated, my name is Chris Norwood, and I am currently the Milpitas Unified School District Board of Trustees President. The Milpitas Unified School District is 67% AAPI community we have over 57 languages spoken. So I'm very familiar with the AAPI community in Milpitas, seeing it. We are a K-12 school district. Well, actually, we're a CDC, meaning like we start seeing children at the age of 2 all the way through adult and with the community college in our area. So we see the full gamut of students, not to mention the parents that are part of the community as well. I am a 47 plus year member of the Milpitas Unified School of the city of Milpitas as a community. So I've seen it change over the years as one of the first planned integrated community in the state of California, and that's why it's so diverse. So again, I'm glad to be here, to be engaged in the discussion. There's a lot to talk about, and I'm looking forward to learning a lot.
Thank you, Chris, and thank you for your contribution for our community. And we're so glad to have you here. So next, I'm going to give the microphone to Elaine. Elaine, microphone is yours.
Hi, thank you, Dana. Hi, everyone. Thank you so much to invite me to join this very important topic. I'm the founder of Mental Health Association for Chinese Communities. We service our Chinese community in the mental health challenge. We must to face the mental health challenge for this in United States, and we provide a lot of things to get the people, let them know they are not alone if they have the mental health issues. So just very happy to be here. Thank you so much. Thank you.
Thank you, Elaine. Thank you so much. Yes, yeah, with all the community leaders here, we are not alone. So next, I would like to give the stage to Sue Chow. Sue, go ahead.
Thank you so much, Diana, and everyone for being here and for starting this really important initiative. So my name is Sue, I'm the co-founder of Awakening Land and True Youth, and we are a platform that enhances the mental well-being of global Chinese community and the wider Asian communities. We bring resources together and deliver it in an understandable manner and enjoyable manner to so that it's adapted to our cultural backgrounds. So I'm also the operation director of the North American Chinese Psychological Association. And our mission is to make mental health resources accessible to Chinese of all backgrounds and strives to eliminate stigma around mental illness. Yeah, so thank you so much for inviting me.
Thank you, Sue. Thank you so much. Yes, we've been working with True Youth for very wonderful events. So thank you, guys. Okay, so I'm going to give the first question to Dr. Mai. And Dr. Mai, what causes AAPI community members to committed suicide, especially our younger generations?
Yes, this is an important question to address. While suicide sounds like a scary word, it is very common within Asian American youth, and in terms of suicidal ideation, suicidal attempts, all of this is quite common among youth in general in America. So while it's scary, we just have to talk about it. That's what it is. But Asian, particularly girls and women between ages 15 to 24 have the second highest suicide rate among all races within the United States. The Eastern Asian culture, as many of you already know, have, so much strength and depth and beauty that, of course, we're all proud of. But it's also a culture that may emphasize blame on oneself, maybe value endurance and tolerating pain rather than taking the action to change one's situation. So that value that is based on a culture that we love and pride ourselves on, that may also contribute to the Asian youth's mental health. Also, Asian Americans consistently seek mental health help at much lower rates than the rest of the population. That is likely due to stigma and also just not having the knowledge. Mental health is somewhat a new topic to the AAPI communities. And while the resources are actually there, particularly in this remote world right now, we don't even need to have local resources. We could access them through Zoom like we're doing right now. Yet it is hard for Asian parents or potentially Asian mentors to know what's available or what to even look for. So I think there's a barrier in terms of accessing help because of the knowledge, and also the stigma in terms of worrying about what others might think about if they were to seek help for their mental well-being in terms of depression or anxiety or other things that they may experience. In terms of rates of mental health disorders, they are very similar to in terms of rates among Asian Americans versus other ethnic populations. Yet the access to the help, because of the stigma and the lack of knowledge, it just becomes a harder bar to go over. So I think all of that is contributing to the lack of support, and then as a consequence, the suicide rate in the Asian community.
Thank you so much. Yes, what you're saying is really, our culture and our value system that people feel they don't want to seek for help. So that they are the ones that really need help, but they normally they don't take this help from our society. But do you think there's a connection between drug using and bullying in school?
I would love to hear more from educators like Chris on this topic, but in terms of, is there a connection? Yes, there is. Yes, there is. Drug use and any stressful event like receiving bullying or again, any type of a stressful event could trigger a thought of suicide or trigger a mental health condition to unravel. I think it's important to acknowledge that, but also important to acknowledge that not all mental illnesses are based on a certain trigger or concrete event. There are many cases where just depression just happens or anxiety is just there, and a lot of these diagnoses or disorders or conditions are heritable, genetic, and brain-based in terms of biological diseases. So it's not just the environment, it's not just the events, and it could just be there as a condition. On the other hand, again, when there is an environmental trigger, somebody who has these loading factors to move forward onto having a more severe condition. So I think it's important to shine light on those bullying or drug use type of events as well. If I could pass the mic on to Chris to hear more thoughts as an educator, that would be great.
Great, thank you, Chris. Yes, do you see that there's environmental triggers in the school?
So the school is a very interesting environment that has evolved over time. It is now taking a dominant role in the household, particularly in the Asian and the immigrant communities, because it's one of the bedrocks of our communities in America, and particularly the Bay Area. So schools are being looked to provide a number of different services that once upon a time the community helped to provide, the elders help to provide in terms of just general understanding of how to look out for one another. And so a lot of kids are coming to school with things that they learned from home generationally that that has an adverse effect. I was recently reading somewhere that 1.6% of middle school students not involved in bullying had some marijuana use, while 11.4% of the students use marijuana. So that's a significant difference in terms of the correlation between bullying and some type of drug use. Again, but we have a good understanding of the fact that, and we see this in schools all the time, when we're dealing with parents, when we're dealing with students, sometimes we find that there are stressors at home. Again, there may be psychological, biological, or whatever else that somehow is also engaging the child, and is coming out in different ways. So I totally concur with Dr. Uchida regards her findings. So we're seeing it actually manifest in schools and classrooms and with teachers, and it is an issue that is really at the top of priority for educators and education systems.
Thank you, Chris. Thank you. You're right. Yes, this kind of mental health issues sometimes happen at school and sometimes happen at home. So what can parents, teachers, and school administrators do to decrease these mental health issues?
Well, there's a couple of things. Understanding where your resources are, understanding and where within the school communities you have like communities, because there are different organizations at the high schools. So Milpitas Unified School District is a K-12 district. So that so actually we start CDC, 3 years old or below, all the way through adults. So there's a number of different micro communities that you can find resources in. So what the school districts really try to do is saying, hey, we have these resources, and trying to find the right method of communication for parents to want to inquire. Because again, Dr. Uchida has stated that some parents or adults saying, are prideful. No, I don't want the service. I'm not interested. It's not my problem. It's not what's going on here. And they're really blind to the facts. You try to find different ways to create awareness. And sometimes it's just an information session that people get a chance to understand that. School districts aren't typically designed, because their number one priority is to provide public education. You know, these ideas around mental health and social emotional being and those types of things, they're new because schools are primarily designed to educate. So now you have a workforce that's primarily has been focused on the education, the curriculum, the pedagogy, now asking them to dip into the psychology, the mental health, and other areas to happen in the school experience. And it's going to be extremely difficult. I think that'll happen in curriculum for teachers' credentialing programs, which I think has value. And so some of the folks here with any advocacy or any strategy, teaching credentialing programs should be touching on these things, because that teachers that come out have some sort of idea on some of the psychology behind these things.
Yes, you mentioned that school focus on education, and but there was many other organizations already been working hard on these issues, like the organization Elaine has. So Elaine, what do you guys, what's in your mind that parents and teachers and school can do to, help the mental health issues?
Yeah, it's a very important topic, and also, yeah, it's the mental health and the bullies. Sometimes we want to find out what's the bully what's behind the bully. And also, as the role of the family member, we must to expose the relationship with their children, to try to know to know about their emotions. Sometimes we, in Asian culture, we don't think our emotions is very important. Sometimes just the rage, just the other things. But if you're sad or happy, it's not important. But we must let the family know that that's very important, how to deal with the emotion. And also I want to point out that the group is LGBTQ group, and this group in school, they are based on the data. The bully, the data is very higher very high, the data rate in the school bully in so I think we must to let the education, the trial education, the people, they know what is this group, what they need and what they don't like, don't to bully them. And also the mental health issues, based on the combat the data from our the support group. Most of the children, they don't think their parents understand them. So I think it's very important let the school provide some resource for the parents, and special for the counselor in the school. And sometimes the school counselor, they need to get them into the education. I remember the case when the girl released from the psychiatric hospital and went back to her school, and the counselor said she didn't know why the girl will get the mental illness, why she's still a straight A student. She was a perfect student. Why she had the mental mental illness? So if the school let them to also request the education in the school and the family member, I think that will be very helpful. Thank you.
Thank you so much, Elaine. Yes, Elaine's organization has been working on this issue, help school and especially parents for many years. And Elaine just mentioned about a special group, LGBTQ. This group, actually, they were really, I would say underprivileged in school. So Chris, do you have any, comments or react for this?
Well, when you look at the LGBTQ community, as they discover who they are and being very alienated because there isn't a large population in certain areas, and there's still a lot of learning and discovering and recognition and shame and stigmas that surround that community, that they're really trying to discover ways to break that stigma so not only those that recognize themselves in that community, but they can live with themselves in the process, because it is a battle where there's this design or this perception of how society you're supposed to be. And that's another one of the things that the AAPI community is dealing with in terms of being here in the United States. It's significantly different. There is a almost undercurrent to assimilate something that you're not naturally, and that causes a lot of the anxiety that folks are dealing with. You know, as an African American man, you know, learning how to navigate a number of different experiences so that I would have the possibility of success, or the ability to make a living or live in the Bay Area. You know, you definitely have to learn a lot of new things, and that is extremely stressful if you don't have a village, if you don't have, you know, developmental assets, if you don't have a community like you guys are talking about. So this work is very, very valuable to help navigate your identity at this time, no matter where you find yourself.
Yes, you just mentioned about navigate your identity. So what public policies should be considered to address this existing mental health matters for youth, and what may be done to help them in the future?
So I think that's a great question. And public policy starts with research. And then it starts with organizations like we have here that are actually doing the implementation of practices, because policy without action, without proof, and without training, without validation, nothing happens. School districts and a number of folks have great ideas or policies already on the books, but there's no one living and breathing those policies on behalf of students and equity and opportunity and social and emotional health and those types of things. So when you have working organizations that are actually doing it, and when you have the research behind it, those are the things that get the assembly members, the senators, the city council members to say, hey, here's the proof and here it is in action. We should be able to follow through with a policy that's saying that everybody should be looking into this, and here's some practices out there. So that is tremendously huge in terms of moving the needle towards policy. In some instances, policy can drive itself, and there are a lot of school districts that have done resolutions around AAPI hate, around anti-Black racism, around LGBTQ. They've just done a number of resolutions, but people aren't at those board meetings. You know, so there's a lot of good things that are out there already that will come from the grassroots perspective much faster than a policy being passed and then trying to enforce a policy. I hope that makes sense.
Thank you, Chris. That's why today we have the organization from the grassroots, and also we have the researchers, and we have the elected officials and the public service leaders like Chris yourself, and you know, to discuss about this important issue. So Dr. Mai, so how may the AAPI youth community address the extraordinary stress of harassment, violence, and the worse that is occurring in a way that protects their mental health?
Yeah, that's a big question, and I'm not sure if I have a straightforward answer, but a few suggestions. The first thing is that to allow yourself to be bothered by it, to be angry, to want to have change. Those things are important things that actually the Asian community has not allowed themselves to feel for a long time. I'm sure everyone's kind of familiar with the model minority myth that I think we have historically made ourselves kind of represent the group that tolerates and would not raise their head when they are, you know, when they're being scapegoated, or and I think that was largely true. Does it mean that we did not like being called certain names? No, we did not like this from the get-go. We just didn't say it. But I think it's a time that is allowing the Asian community to have a voice and allow ourselves to be angry at the things that we should be angry about. So I think allowing yourself to feel that emotion and express it, I think that is humongous. I actually think that social media, as much of a problem it could be for youth as well, it also could be an advantage in terms of expressing it. It gives people a platform to express their opinions and get the feedback that some people need. And I think that has been one of the things that, again, with its problems, been a venue for many of the youth to express what they want to say that they couldn't say before. So I think I do like that movement. And then I think really being in tune with, I mentioned about allowing yourself to feel the emotions, but being in tune with that emotions. Do not ignore the fact that you're actually quite anxious about going outside because you are afraid of being attacked, or do not ignore the fact that that you're quite sad and feeling lonely or isolated because of what you're seeing on the news. What somebody that looks like you is being called. If that is more than bothersome, and if it is really eating you up, that may be a sign of mental illness. And I think mental illness, the illness part is such a heavy word, but a mental health condition or mental illness, whatever we want to call it, if you're not happy about how you're feeling, and if you feel like that unhappiness is impacting what you can and cannot do, then that's a problem, and it's okay to get help. And I think just talking about it is extremely important the way that we're doing right now. And I hope the conversation continues.
Thank you. Thank you so much. Yes, when you are talking about this, I remember that when I was a child, my mom is a very tough mom, so she won't allow me to cry. Even I have tears in my eyes, and she pointed me and said, "Stop your tears, stop crying." So we talk that way, even when we were a kid, a very young kid. So this is the part of the Asian culture. So so it's okay. Like Elaine also mentioned about that, your emotionals, our emotions. We don't show our emotions, but this is really not healthy. That's part of the problem, probably, causing the suicide for some of the young kids. So Sue, I know that, you guys have the organization and True Youth helping the younger generations. So you also have some group of the researchers working together on this. So what are the early signs to notice to prevent the suicide intentions?
That's a really important question to ask. So we noticed that about 75% of those who die by suicide, so they successfully committed suicide, they actually give warning signs beforehand. So they either might talk about suicide directly, they want to talk about death, and sometimes they even make a joke about it. You don't even realize that that's their signal for help. And sometimes they actually taking the steps to prepare for their death, like giving away their treasures, like giving away their pet, like something they really cherish, when they really cherish, like their possessions, they give it away to other people. And there are usually also signs of depression. Sometimes they distance themselves socially from others, even those that normally are intimate with them. And also there might be a change in personality. So ironically, usually, sometimes right before they decided, that's it, I'm going to give up, they suddenly seem even optimistic all of a sudden. And this is an attempt actually to hide what they are really thinking. And it's an attempt to distance the real self from other people. Yeah.
Wow, those are all the signs. But actually, sometimes we do see those signs from in normal people, this may not be, that serious, but how can we tell is that serious enough or not?
I would really like to hear that from other specialists, like professionals, like Dr. Uchida or Elaine. I think they would have more detailed knowledge on this. From my side, I think like if it doesn't matter when someone talks to you about suicide or they're thinking about death or they're thinking about killing themselves. It doesn't matter how they say it or what their tone of voice is. I think it's most important thing is to take it seriously and ask, are you thinking about killing yourself right now? And if the answer is yes, we need to take this seriously. And the best thing you can do is to help them get professional support.
Wow, thank you. So you suggest that we ask them directly. So Elaine, what's your suggestion? What are the signs that you would see that in the past?
Yeah, I agree with so yeah, I think it's directly to ask is a good way, but we will ask more detail about that. Any plan for your suicide? So why you want to do that? And also we must to confirm that the emotion is right, and maybe they feel not hopeless and feel very afraid. Just like yesterday, we saved the lady, and she just said, "I'm so afraid, so I don't want to live in anymore." So we will confirm then, and we will call the mobile crisis team to help them to get the treatment, get the resource. So just like Sue said, is we must to take it serious. Sometimes when this happen, yeah, don't make it just some people they will say again and again, but even their family members say, oh, she always say that, he always say that. But we also have the case after 1 year later, he commits suicide. So we must to take it serious to know how to support him, how to help him. He need help at this moment. So what's the resource for them? So thank you. That's my opinion.
Yeah, thank you, Elaine. Thank you. Yes, I did, I did heard about this story that someone talking about suicide and many times. So her family said, oh, well, it's like the wolf is coming, but the wolf never come, like the stories, the saying. But actually, when we heard this sign, we should take seriously about what they said. Yeah, thank you. Yes. Okay, so let's come back to, our topic today. So what are your solutions to empower youth to face challenges and help them to fulfill their American dreams? Sue, you want to go this one?
Yeah, thank you for the question. I think it's a really good question. I think it's important to recognize that Asian American, the AAPI community is a really diverse group. When we say Asians, we're talking about so many cultures and so many languages and different views and different histories. And because of this, sometimes we can be divided as a group. And so it's important to enhance a sense of belonging among this community and to create an open and non-judgmental environment, especially for young people to share their personal experience and to speak up and to stand out. So I think it's important to celebrate how unique we are and to establish that sense of identity and the connection with yourself and with our group. I think there are research results who that confirm this actually lowers the risk for suicide. And we talk about American dreams, considering when you take into consideration how diverse we are. I think there's endless possibilities of what we can dream of, and yeah, and this is basically what we have been doing at True Youth. And another way to empower youth, I think, is to provide them with high quality mental health resources. And this is not just something only the government or the nonprofits can do, but also for business as well. I think when it comes to people at risk, there is a responsibility for businesses to help make these content and make these resources more affordable and accessible to those people, and to adapt these resources to our cultural backgrounds in a way that makes us feel understood. And this means going beyond the language interpretation services, also for staffs and caregivers, professionals who serve the AAPI communities, to be able to have a better understanding of the culture in which we come from, and to think about the cultural backgrounds as something that would make our experience different from somebody else's.
Thank you. Yeah, you mentioned about the quality mental health resources. That's why we have Dr. Maya here, and also the Chris is also working on this. So Chris, what's your solution to empower youth to face challenges and help them to fulfill their American dreams, especially the multicultural ethnic group?
So that thank you again for the question. And the information that I'm hearing now is very valuable as we look at how the Milpitas Unified School District applies it to our school district, but then not only as a board member who has contact with other board members, and at the state level, being able to share these insights with them as well. So I will definitely be recommending this podcast for them to be able to listen to get just a better understanding of the different perspectives that you brought here today. When we think about the solutions in the Milpitas Unified School District, we have 5 strategic goals. And within our 5 strategic goals, we have this thing called build a culture of we. And the culture of we is to recognize all of the different cultures that we have. And culture is just not based on ethnicity, but again, LGBTQ, surfer, sports athlete, just allow everyone to embrace who they are as a part of the culture of we. And then at the high school level, there are a number of different activities. There are a number of different clubs that recognize each other. They recognize their differences so that they can work together. We recently adopted in the Milpitas Unified School District the fact that we're going to do ethnic studies program. And that ethnic studies program is going to be rooted in the demographic of the district. So we're going to make sure that our ethnic studies programs mirrors our community and empowers them and strengthens them in terms of the assets that they have as individuals, and then understanding the context of their history with other histories. So there's a lot of things that schools can do in terms of solutions, and these are several of the things that the Milpitas Unified School District is doing currently. We're really looking also deeply into our special ed department, because you talk about where special education starts and mental health starts, mental health stops. It's a very fine line. So we're really taking our deepest dive ever in these 2 arenas, because the times that we're recently dealing with has really exacerbated a lot of the things that we're talking about now. And so those are the solutions that we're looking at, again, recognizing the demographics of our district and the future of that district. Our number 1 strategic goal, build the culture of we, and then allowing everyone to really understand that in the we, I'm included. Now, that doesn't mean we always get along. That doesn't mean we always agree. That doesn't mean that I have to like what you like because we're a part of the we. We're just part of the we together because we all have a common goal, and that's for us to live our best lives as our best selves.
Thank you. I really like build the culture of we. Let everybody appreciate the difference and also embrace who they are and as an individual. Thank you so much. And we would like to work together with you for these issues and help our community. Yes, that's so wonderful. So the last question, I'm going to give this question to Dr. Mai and Sue and Elaine. So what we can do, Sue, do you think your organization successfully tackled this major issue in our society?
Well, we approach the issue of suicide from quite a different angle. Excuse me. So at Awakening Land and True Youth, our goal is to eliminate the stigma around mental illnesses as a whole, So by combining mental health and psychology with entertainment and arts and cultural industries, and make the content entertaining, enjoyable. So when people think about mental illness, and I know this from many of our Chinese American audiences, they usually think about, lunatics and dark thoughts, abusive experience. So things that are quite negative. And the sense of shame is preventing a lot of people from getting the help they need. And we want to change that by making self-care and self-development into a really cool thing to do. And we're working with world-class psychologists and artists to develop our events and courses for the AAPI communities. And we're also working with parents and families to give them the tools to respond to their children's needs in a more supportive manner. Even though we're not working directly with clinical suicide cases, but as entrepreneurs, we are undertaking this social responsibility to improve the environment around Asian Americans with suicidal thoughts. So by making it more supportive.
Wonderful. Thank you, Sue. Thank you. Yeah, Dr. Maya is the top psychologist here today with us. So Dr. Maya, what you and your organization can do to help?
Yeah, so one part that I think that we're currently doing right now is representation in terms of women of Eastern Asian ethnicity, as well as a Black man who is serving for a very diverse community to come and speak about this. And I think that is a very different visual and an impression that people get from people who are just maybe reciting data from a general population that may not be relatable to the AAPI community. And so I think representation is huge. One of the efforts that we recently did, kind of echoing what Sue mentioned in terms of making mental health cool and fun, I released a YouTube video series interviewing Mirai Nagasu, who is a Japanese American figure skater who has gone to 2 Olympics, missed one, had experienced the depression and some suicidal thoughts, took antidepressants as well as engaged in therapy, and got back on the Olympic team, became the first American woman to land the triple axel at the Olympics, and kind of became an icon of resilience. And what was so interesting in the interview that I did with her, so many things that were interesting. One was that she became national champion when she was 14. So much of her competitive career on the spotlight was in her youth as a teenager. And that was a big topic that we discussed about in terms of what it was like for a second generation Asian youth to be on the spotlight, being a national champion of America, and go through these burdens related to mental health. That was extremely interesting, and I think relatable to many Asian youths who are not Olympians. And another part was that while she landed the triple axel in the Olympics, she did not see her Olympic experience as a success. And she's a bronze medalist, and yet she did not see that as a success because she could have done this and this and that so much better. And after the Olympics, she was so mentally tired that that's when she engaged in actual therapy. And I love that story because it kind of redefined the meaning of success, which is a really important topic for particularly Asian communities to engage in, because maybe what a certain family or a culture or maybe their parents define as success, or oneself define as success, may not be what we are looking for. For her, she feels really great right now because she engaged in mental health treatment, and she She is living the very stable, happy life that may not be in the spotlight as much as she used to be, but she is successful at living life right now because she's happy. I think just that sense of success or even failure, I think that's something that should be in the topic of discussion. And then, along with the lines of success or failure, I think mental illness or mental health is talked about the perspective of a disorder or maybe a mental weakness, that it is something that is bad. But actually engaging in mental health treatment is something that you're doing. You're putting in effort to be successful in terms of your mental wellness. And I think maybe reframing that in a way that may sound better to the Asian eyes in a way, or yours, I guess, that might be something that we could do as well. So that's an effort that I'm engaging in the depression program at MGH. And there is also a program called the MGH Cross-Cultural Center for Cross-Cultural Student Emotional Wellness. That is targeted for the transitional age from adolescence to adulthood, because that's when in America, many of the youth are starting to get a sense of independence and may be allowed to get treatment for themselves rather than relying on the older generation. And what we've been seeing is that by targeting that age range to engage in this conversation and discussion, they talk with their parents, and that might bring in their parents to this type of a conversation. So these are the efforts that we are actively doing, and we're seeing pretty good results. So I am just so happy to hear that there's so many other types of efforts with the same goal going on across the country, and I hope that there will be more.
Thank you. Thank you so much, Professor Mai. And you mentioned about your YouTube channel, and how can people access to that?
Yes, so I think the YouTube channel is MGH Child Depression Program, and you can certainly just search for that term. If you Google probably a mental health conversation, Mirai Nagasu, that might come up as well. There is a website that we built specifically for the conversation with Mirai, and that one is Student Wellness, so MGH Student Wellness / Mirai. Wait, sorry. I'm gonna say it again. www.mghstudentwellness.org / Mirai. And I think you'll find there's actually some fact sheets about depression, some fact sheets about Asian American and Pacific Islander health. There's a resource page on how to access resources, along with some take-home points from the video as well. So I hope everyone enjoys it.
Yeah, thank you. Thank you so much. And we hope someday we can have Mirai to be on our show and share with us.
That'll be cool.
Yeah, that's so wonderful. Thank you. So Elaine, so I know that you've been working on this issue for many years, especially for Chinese American. So what resources your organization can offer?
Okay, thank you, Dana. Thank you, Dr. Mai, to bring our very important topic. Is the recovery is possible. Is possible. Yeah, recovery is possible. So let the people feel that. Let the people know that the whole is there. We had the whole. It's not just like we had a mental problem, mental illness. That there will be. We are not whole. They are had the whole. The treatment is worse. And as our mental health association for Chinese communities, we in the past 10 years we focused 3 parts. One is the education, and I think the other panel already said a lot. Education. We had a workshop panel with the psychiatrist, yeah, and the profession person to host the workshop. We already hosted more than 200 workshops in the past year, and we are the long-term partnership with with NAMI, Mental Health Association for Chinese Communities. I know it's mental, and it's National Alliance on Mental Illness. We had a strong and longer partnership with them. So we had a lot of the free class provide to the Chinese community. We had the NAMI family to family, NAMI peer to peer, a lot of this very useful resource for our community. And the other part is the support. Is our very strong part. We had the support group there, and every week almost, and we had in Cantonese, English, and Mandarin. We provide a very strong peer support. Is very important when the people had the same situation, the background, they will more understand what the situation is. And the other, the last is we are developing 2 mobile apps, for provide support service to our community. One is the target the user is who had attempted suicide, so immediate survivors. This ad is we wanted the people to just use in free, and they can get some resource very easier. So we still on working for that. And also we also had another ad that they will is for the family member, the caregiver is affected by mental illness if they are family member. I think we still work for that, but I think we can see the whole. And the other, the last one is advocacy. So I know that I already know we always focus the policy, because this policy maker, they will make maybe the policy will help the community, just like the Furman Assembly member Ken Sin-chu, he put the bill AB 2022, and this for the school district must provide the professor in the high school. So I think we will get together to let the stigma reduce the stigma, to let our voice to be heard. That will important. So I'm so happy today. We had a lot of the panelists. We can talk about this topic. Thank you, Dana. Thank you.
Thank you, Elaine. Thank you so much, and I'm just so glad that we are able to talk about this important issue and how to empower the youth to, have the really health. Mental health issue. The mental health is a very important issue to face the challenges and help them to fulfill American dream. Not only our youth, but ourselves. I feel like we at AAPI community really need this resource, and this dialogue will continue in the future. And like Dr. Mai said, and we need to redefine what does that mean to be success. And what is the meaning of life? So I hope that we can invite you guys back and continue this conversation. With that, we're going to conclude today's discussion. And thank you all. Thank you, everybody. And thanks to AAUC and also the Ding Ding TV and everybody who work behind the scenes. Thanks to all our speakers. See you next time.
Take care.
Thank you. Thank you.
Thank you.
Thank you.
Thank you.
Talk to you later. Thank you.